Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, gastroesophageal reflux disease. Right. In the gastroesophageal reflux disease, actually, first we will see the pathophysiology of gastroesophageal reflux disease. Okay, in the gastroesophageal reflux disease, actually the lower esophageal sphincter will play an important role in preventing the reflux into the esophagus. So lower esophageal sphincter will prevent the reflux of contents from the stomach into the esophagus. So what are the factors which contribute to high pressure zones in the lower esophagus? Factors which are contributing to high pressure zones in the lower esophagus are: one, intrinsic muscle of the distal esophagus. The intrinsic muscle of the distal esophagus are in the state of tonic contractions. So intrinsic musculature of the distal esophagus, because of their tonic contractions, they will induce high pressure zone in the esophagus, and thus they cause high pressure zone. Even the cardia sling fibers of cardia, especially which are at same anatomical depth of the muscle fibers. These sling fibers of the cardia are at same anatomical depth of the circular muscles of esophagus but are at different orientation. So this is also helps in high pressure zone because of having at the same depth, that is at the same site, but they have different orientation. So as a result, they are responsible for high pressures in the lower esophagus. Then we have diaphragm. Actually, the anteroposterior diameter of the crural opening is decreased. Especially anteroposterior opening of the crural opening of the diaphragm is decreased during inspiration. So in the diaphragm, the anterolateral opening of the crural opening, anteroposterior diameter of the crural opening is decreased in the diaphragm. Whenever there is decrease in anteroposterior diameter of the crural opening, this will result in compression of the diaphragm. So this will lead to compression of the diaphragm. When the diaphragm is compressed, this will lead to the increased pressure at the lower esophageal sphincter. The esophagus is compressed. So whenever actually this is the diaphragm, this is the esophagus. Around the esophagus there are right crus of diaphragm will be there and left crus of the diaphragm. So these crural fibers, the diameter is decreased. In such cases, they will compress the diaphragm and thus increasing the pressure at the lower esophageal sphincter. And also sometimes there is transmitted pressure from the abdominal cavity will also increase the lower esophageal sphincter pressure. Due to all these, there is lower esophageal sphincter pressure is seen in the gastroesophageal reflux disease. So if there is any defect in any of these, then the pressure which is present is less, thus resulting in reflux of contents from the esophagus into, from the abdomen, that is from the stomach into the esophagus.
thank you and thank you for watching.